Good day everyone, welcome back to my channel. Today we'll be talking about hyperprolactinemia. This means having high levels of prolactin in the blood. Prolactin is an hormone that is responsible for breast tissue development and lactation. The most common cause of hyperprolactinemia is prolactinoma, which is a non-cancerous tumor in the pituitary gland. Let's talk about the symptoms of hyperprolactinemia. The first symptom is loss of interest in sex, which is also known as low libido. We also have symptoms like infertility, low bone mass. We also have symptoms like milky discharge from the nipples when not pregnant and not breastfeeding. We also have symptoms like changes in menstruation cycle. When you have changes in menstruation cycle, it can be symptoms of high prolactin in the blood. We also have symptoms like painful sex due to vaginal dryness. Yeah, these are symptoms of high prolactin in the blood. Now, let's talk about what causes hyperprolactinemia. As I said earlier, it can be caused by prolactinoma, which is a non-cancerous tumor in the pituitary gland. We also have causes like certain medication and certain health conditions. Now let's talk about some medication that can cause hyperprolactinemia. We have birth control pills. We also have certain antipsychotic medications like haloperidol and risperidone. We also have high blood pressure medications and antidepressant medications. We also have medications that are used to treat nausea and vomiting. Some of these medications can lead to hyperprolactinemia, and also pain relievers that contain opioids can also lead to hyperprolactinemia. Now let's talk about health conditions that can cause hyperprolactinemia. We have chest wall injuries, we have chronic kidney diseases, we have chronic liver diseases, and we also have polycystic ovary syndrome. Like I said earlier, like we discussed earlier, PCOS can also lead to hyperprolactinemia, which is high prolactin in the body. Yeah, we also have another cause which is known as hypothyroidism, which is known as underactive thyroid. When the thyroid is underactive, is not active, it can lead to hyperprolactinemia. Now, there is no way of diagnosing it if it's not only through blood tests. Blood test is the only way to diagnose prolactin, if it's high or if it's low. And the only known risk factor for hyperprolactinemia is what we know as multiple endocrine neoplasia type 1. It is an inherited condition that can cause prolactinoma to start in the body, which is known as the non-cancerous tumor. Now, let's talk about the management and treatment of hyperprolactinemia. We have medications like dopamine agonist, which helps to regulate the prolactin level in the body. This medication helps to shrink prolactinomas in the body and also treat hyperprolactinoma. We also have surgery. Surgery comes in place when the medication does not work properly. So the surgery is done to remove prolactinoma from the body. And we also have radiation therapy, which is used if surgery and medication doesn't work. Now, I would like to add that hyperprolactinemia is not a life-threatening disease, but it can lead to infertility and other issues that may affect one's quality of life. But the good news is that it is treatable. And so, if you notice that you have hyperprolactinemia, it's important to treat it immediately to avoid complications like infertility in the future. Thank you for watching my video. Please, I urge you to like, comment, and subscribe for more updates. Thank you.